Hi, I'm Dr. Monica Verduzco-Gutierrez, a physiatrist and professor and chair of the Department of Rehabilitation Medicine at the Long School of Medicine at UT Health San Antonio. I'm pleased to talk to you today about evaluating red flags in headache presentations. About 70% of headache patients seek care in primary care settings. Many patients with migraine do not receive an accurate diagnosis. Accurate diagnosis of migraine is essential for patients to receive good medical care, especially in primary care settings. An accurate diagnosis depends on a complete medical history, including headache history and physical exam. When taking the patient history, ask about headache pain pattern, such as when and how do the headaches begin. Medical history, such as any experience of depression or anxiety. Associated symptoms, including any symptoms preceding or accompanying an attack. Treatment history, including any acute headache medications that have been taken to exclude medication overuse headache. Family and social history, especially the history of migraine, and the nature of the pain, including its location and severity. Physical exam may include cardiovascular screening and neurologic examination. Consider neuroimaging only when a secondary headache disorder is indicated as a red flag. While most patients present with primary headaches, recognizing when a secondary headache is present is important, as it may indicate a need for evaluation. Primary headache disorders have no known underlying cause. They include migraine, tension-type headache, and cluster headache. Secondary headache disorders are the result of another underlying condition, such as infection or trauma. It is important to recognize them, as they may be serious or life-threatening. Red flag mnemonics, such as the SNOOP4, can help identify secondary headaches, including those that warrant urgent investigation. SNOOP4 refers to red flag signs or symptoms: systemic, neurologic, onset, being sudden, older, age at onset, a pattern change, precipitated by valsalvar maneuver, postural, and papilledema. SNOOP10 retains the red flags of the SNOOP4 and adds additional signs or symptoms of related secondary headaches. Asking about pregnancy from the SNOOP10 is important, since pregnancy can increase the risk of some secondary headache disorders. Potentially life-threatening secondary headaches need urgent attention. If a secondary headache is suspected, accurate diagnostic workup is needed to identify the cause. Example cases where urgent referral is needed includes a new onset of headache with jaw claudication, as this could be indicative of giant cell arteritis. Any visual disturbances, along with headache, worsened by exertion, as this could be due to idiopathic intracranial hypertension or spontaneous intracranial hypotension. A progressive headache that is worse in the morning or accompanied by vomiting, as this could be due to a brain tumor. If there are no red flags indicating a secondary headache, consider if migraine can be identified as a primary headache disorder. ID migraine can help identify migraine. A migraine diagnosis is likely if the patients respond affirmatively to 2 or more items. If a migraine is identified, consider referral to a headache specialist for migraine management. If migraine is not confirmed, consider differential primary headache diagnoses. Here are the key differences between migraine, tension type, and cluster headaches. To summarize, here are the key takeaways to assess red flags and support with the appropriate management of headaches. Thank you for listening.